Good afternoon and welcome. Thank you for joining us today for our training, Tools for Creating Calm in Times of Distress, hosted by the Center of Excellence for Behavioral Health in Nursing Facilities. I am Nikki Harris, Training and Education Lead for the Center of Excellence, and we truly appreciate each of you for joining us today. And now, I am happy to introduce our presenter for today, Matthew Rosa. Matt is a licensed clinical social worker, consultant, and founding member of NIA TX Change Leadership Academy. Matt provides training, coaching, technical assistance, and planning support to universities, research studies, governments, and of health and human service provider organizations. Matthew's current area of focus includes evidence-based practice implementation, process quality improvement, staff and team development, and a wide array of training topics. And now I'll turn it over to Matt to begin the presentation.
Thank you so much, Nikki. Thank you as well, Derek. I appreciate that. And thank you all for being with us today. It's great to have you here. We have a few learning objectives to get us started with our focus for our conversation today. We can take a look at these four. We're going to look at developing greater empathy and understanding related to distress, gaining insight into personal reactions to distress, people who are experiencing distress, reviewing some tools for responding to distress, and particularly we'll address these second two in our second half of our training, which will be coming in the future. We'll give you a little info about that at the end. And also identifying risk and safety boundary issues related to distress. So that's where we're going to be today with our conversation. We also want to frame this up on the front end by saying, whose distress are we talking about? Sometimes folks might make the assumption, well, we're talking about residents and their distress and the things that they're encountering. I want us to have a slightly broader lens, a broader frame when we're thinking about these issues. It could be residents. It could also be staff of your facility. It could be family members of residents or other partners, other parties with whom you're engaged in the work, partners in who help you to provide the services you're providing. So think about it from a broad perspective, because of course distress happens for folks in a wide array of environments. So think about also, as we get started, the kinds of sources of distress that you are encountering in your work. If you want to put something in the chat for us right now about where you might be seeing a high level of distress among the folks with whom you're working, again, in those different categories. It might be one of these categories that we've identified because those are pretty common. It might be something else. I'm always curious to hear if people are thinking about distress that they're encountering that does not fit into one of these boxes. But please go ahead and share with us if you have a particular area of concern or focus, because that's always helpful information for us going forward to hear what it is. Yeah, so folks are already sharing. Barbara mentioned mental health. And so think about these other categories. Which one is number one for you? To take a minute to let us know which might be the number one area where you're seeing distress among the folks you are working with. So thanks for doing that. So as you're doing that and thinking about those areas of distress, I want to take a moment to think about the kind of key challenge that we have as it relates to responding to distress. This is kind of the simple flow chart or process map. You're engaging with an individual. You're trying to provide care. Let's assume that that's a resident. You're trying to provide some care and some supports. Then there's some distress that they're expressing, that they're sharing with you. And we might want to try to keep pushing through that encounter, that distress, in order to continue to provide that care. What I'm going to be encouraging you to do in this session and in the follow-up session is to take a bit of a pivot, to take a bit of a detour. Now, when I say detour, a lot of folks might say, I really can't detour because three issues that I encounter with a lot of systems and folks with whom I work: task, time, and tools. And what do I mean by that? Let's take a minute to think about that. So time, I don't have the time to take that detour. I have to complete these important tasks as part of my work in providing the services, supports, and care that I'm providing. I don't have the time to unpack this distress. I just need to keep going with whatever it is I'm trying to do. I don't have the tools. I'm not quite sure how to do it because this distress is presenting itself in a way that I don't feel like I have the tools to respond to. And so I'm just going to try to keep going as best I can. And the third one, tasks. I have a bunch of stuff that I need to do. And this is related to time, of course, because that's where the time pressure comes from. I need to get back to or continue those tasks, either with this individual in my care and support with them, or with other people where I have responsibilities and duties. So these three elements kind of come and interact with each other and leave us in this spot where we're saying, I don't know if I want to take this little pivot, take this little detour, and try to figure out this distress. So then we go ask this question: what tools can we use to respond to distress while completing our planned tasks within the limited time that's available to us? That, I think, is the dilemma. And because of that particular dynamic, there's this sort of Pandora's box orientation. A lot of folks I work with in many different environments will often have a Pandora's box, what I call a Pandora's box anxiety about this moment. You're probably familiar with this Greek mythology around Pandora's box. So Zeus gives Pandora in this myth a box, and it's a special box, and Pandora is instructed to never open this box. Well, Pandora opens the box, and inside are all the troubles of the world, which come flying out of the box. And here, then we have to deal with these troubles on an ongoing basis. So this is this mythological story. So the idea here, if I open this box of trying to sort out this distress that this person is experiencing, am I opening that Pandora's box, and am I not going to be able to put the stuff back in the box if I try to unpack it? And what am I going to do thereafter? So we're going to work today and with our follow-up session to talk about how you can feel confident in knowing that there are some clear, concrete things that you can do to unpack this box effectively, of this box of distress. And it is not a Pandora's box. There are concrete things you can do to manage that moment effectively that will create a better result for you and allow you to more effectively move on to the next tasks and duties that are part of your workday. So thinking about these goals that we have, we want to enhance our response to distress through developing more empathy, more self-awareness, more knowledge of the causes of distress, figuring out what tools we can use, and considering risk and safety factors. And for the remainder of our time today, we're going to talk more about empathy and self-awareness. So let's take a minute to talk about empathy. What do we mean by empathy? Maybe put in the chat a bumper sticker's worth of words about what empathy means to you. What is your definition of empathy? If I say define empathy, what does that mean? We use this word all the time. Give me a few words. Anybody who would like to. Appreciate you sharing. What does empathy mean to you? How do you define it? Let me keep an eye and see if anybody gives me a definition for empathy. Empathy, connection, feelings, thank you. Putting yourself in someone else's shoes, the ability to understand and acknowledge the feelings of others, solidarity, ability to understand and share, putting myself in the place of others. Yeah, okay, great, solid. Appreciate these definitions. This is at its core about understanding the other person's experience, the putting yourself in someone else's shoes. In order to do that, I have to understand what it is like to be in their shoes. I have to appreciate. So understanding and empathy, I think, are two words that work well as synonyms in this context when we're thinking about this. What are the thoughts that a person is having? How can I understand those thoughts? What are the feelings that they're experiencing in relation to what they're thinking? And what are their actions that are resulting from those thoughts and those feelings? And how do I understand those things so that I can truly have what we're defining as empathy? And all of the different frames that you all described, which I appreciate very much. The name that we're using for this training is intentional. It is related to this notion of empathy. Here's two ways to frame up distress that people might be encountering. On the left, we see creating calm for distressed people, which is the language that we're choosing to use. On the right, we see dealing with difficult people. We see that on the right, this language does not have empathy. It's more of a judgmental, stigmatizing, finger-pointing sort of a language. We're describing and judging the person as difficult. I would say that's less than empathic. It's not really trying to understand and appreciate. It's more of a labeling or of a judgment. So we're trying to frame this up as a way to stay connected to people, talking about their personal experiences, how we can better understand those. So if we think about ways to do that, we have to understand that everybody's different, right? Unique individuals. We're talking about distress that's encountered by one person. If you've seen one person's distress, you've seen one person's distress, right? Everyone responds to different kinds of challenges or experiences in different and unique ways. One tool that I want to encourage you to use is something called an empathy map. Maybe some of you have seen this before. It's a very simple, effective tool for trying to understand a person's experience and to have the ability to have that clear empathy toward them. First, you think about what they're saying and doing. So start on the left side. What are they saying? What are they doing? And once you've had a sense to think about what they're saying or doing, how does that lead you to understand what they're thinking and feeling? Are they telling you what they're thinking, telling you about their feelings? Can you make certain connections based on what they're saying and doing related to how they're thinking and feeling about whatever the situation is? And then what are their goals? And by goals, we usually think of goals in the longer term. Longer term goals are fine. People might have longer term goals that are part of this interaction related to their distress, but also what are their goals right in this moment? Do they want something right now, right? Is there an intention that they're seeking at this moment? If I can put those together, what they're saying, what they're doing, which leads me to understand more about what they're thinking and feeling and what their goals are right now, what they're trying to achieve right now, I'm in a pretty good position to have strong empathy toward them. And if I have that strong empathy toward them, we know that there's this tremendously powerful spiral that can happen, this upward spiral, which is about empathy and trust. If you are expressive of that level of empathy towards someone, then they will be trusting toward you. They will have more trust in you, confidence in the relationship with you. As a result, they will tend to share more honestly and more openly with you, which in turn allows you to have an expansion of that empathy toward them. And the relationship just moves upward, right? We know that the opposite can happen as well. If there isn't trust, if a person is not sharing, it's harder to have an empathic response to them, which can lead to a deterioration in the relationship. So what we want is this upward spiral of empathy and trust and effective communication as you're interacting with folks. So self-awareness is a big part of this. Self-awareness is critical to being able to manage circumstances where people are experiencing a good deal of distress. So you have to know yourself. You have to understand your own reactions to the distress that other folks are expressing. So if you see certain kinds of things, think about who you are, your temperament. Some of you have had training and experience so that you have more professional responses to certain kinds of distress or difficult situations that you might see out there in the world. Think about your temperament maybe when you were a kid. How did you tend to respond when you saw someone who was really upset, or when you saw something doing something where they were maybe breaking some of our social norms or rules, or were very upset emotionally? What have you historically tended to do in reaction to those things? Do you try to be constructive and helpful? Is that your tradition? Did you do that when you were a kid as well? Do you kind of take a step backwards? Do you take a step forwards? Do you sort of try to mind your own business and kind of move over into a different territory? What is your response to those strong emotional expressions? It's important to know your own personal tendencies and who you are and how your temperament is structured based upon your experience and how you happen to be built as a person. We know that there's a lot of ineffective reactions. We sometimes tend to get angry. We tend to be fearful in response to distress. We might try to fix it. We might try to control it a little bit based on some rules. We know, if you think about your own experience, if you look at this slide and consider these different kind of power-based judgments or rule-based responses, think about how you react to any of those when you encounter them in your own experience. And of course, We know that whenever we're in a position of any kind of power or authority and we assert ourselves with this sort of a expression, we're tending to probably escalate the distress, probably diminish that kind of connectedness and that trust building that we're seeking. So we want to try to avoid these sorts of judgmental language whenever possible when we're encountering someone. One of the best ways to do that is to remember to think about how your buttons get pushed. Some of you may be familiar with this idea of transference and countertransference, which comes from psychology. It's a kind of traditional term from object relations psychology. Who pushes your buttons? Who is it that you react to? You've had this experience maybe when you've interacted with someone where they can say, I can tell you don't like me. Well, you haven't done anything to create that impression. So clearly they're projecting because maybe they're not feeling good about themselves or they have some lack of confidence or insecurities about something. So they are transferring that onto you. Now, do you in turn counter transfer something back onto them and create this loop of these projections onto each other? This is what happens when people push our buttons, right? We have reactivity, which might not be appropriate or applicable to the circumstances. So if we know ourselves, we know the kinds of circumstances that tend to push our buttons. So we need to always be mindful. Where do I tend to be at risk of having certain kinds of reactivity when I'm encountering certain situations? If people are angry, if people are feeling really sad and emotionally expressive of that sadness, what kind of a reaction do I have in those circumstances? And that's about me and who I am and how I interact in the world. So do I know myself in that regard? When we get really good at that, when we get good at knowing ourselves, when we get good at using that empathy circle that we were talking about, then we are able to build this foundation and this empathy and self-awareness in conjunction with the tools. And as I said, with our next session, we will be digging in on some concrete tools, some very user-friendly, specific tools. They don't require that you have a background in mental health or substance use services in terms of professional training. They're tools that anybody in any kind of a human service or health environment can be using effectively. So in your environments, these all will be tools that are applicable for you. So once we think about that empathy and self-awareness foundation, then plug in some tools, then we get to that level of compassion, compassionate responses. I like to think about compassion as empathy in action, right? We're doing and interacting in a way that it's expressive of that empathy, regardless of the kinds of distress that people are sharing with us. So as I check the clock, I see we have a minute or two before I am going to hand off back to Derek. I want to just check our chat and see if we have any questions that we might be able to answer. And if you have one right now, please feel free to share it with us because we have a minute or two to be able to look at that if you have one. And I might ask you also to when we reflect on some of those earlier issues that came up at the beginning of our conversation when I was asking you the kinds of environments. Does anyone have a particular kind of distress that they encounter with folks that they'd like to think about how to manage more effectively? Yeah, I appreciate Susan's comment about empathy being a very personal emotions. It differs depending on the individual and the situation. Yeah, I think that's a really important guiding idea that everything is different. Everybody is different, and the way we experience and encounter each other is terribly unique. So always recognizing the uniqueness. A dyad of two people coming together is a unique encounter that will never be seen again, never has been seen before. So we have to honor that uniqueness. The way we see the world is different. So there's a certain humble orientation that I think is particularly helpful. Confusion, as Cheryl's describing, how about confusion? And thinking about if someone is confused, as it might relate to some cognitive impairment or dementia or some other issues that might contribute to confusion, if that's the category. And then what kind of emotional state is the person in as a result of that confusion? Does that create fear? Does it create agitation, frustration, anger, sometimes hostility, aggression as well, right? So we can have a bunch of different emotional reactions to that circumstance.